Headed for a stricter lockdown level around the country, or perhaps broken down into each province? Well, some experts are calling for tougher restrictions to contain the spread of the coronavirus. This as some of the provinces are now experiencing this third wave of infections. Large gatherings are said to be of very serious concern. I just spoke to an expert about that. Let's now speak to Professor Mark Mendelsohn, who is Head of Infectious Diseases and HIV Medicine at the University of Cape Town, or UCT. He joins us to discuss this possibility. Professor, good morning to you. It's always a pleasure speaking to you. I'm sure you are now well aware, multiple calls from various sectors for tougher restrictions, tougher lockdown levels, if you will. Is that going to stop us going into the third wave in the rest of the country?
No, I don't think it's going to stop us going into the third wave. I think that's inevitable. What it may do is reduce the intensity of that wave. COVID-19 remains, as it is, caused by a respiratory virus that is transmitted, as we know, predominantly via airborne route. And therefore, the main issue around the measures that need to be put in place is stricter measures on indoor gatherings in particular and mass gatherings in general, because these are the super spreader event areas, and these are the ones that you really need to be very careful about.
I imagine it's very difficult, though, I'm sure, Prof, to come up with a number as far as indoor events are concerned, whether that be churches, whether it be movie theatres, casinos, etc., etc. How do we try and find a number that can still allow, I hope I haven't lost the professor on this, he might come back in a moment. I'm going to continue with Professor Mendelsohn, if you can hear me. How do we choose a number that will allow these businesses to still operate, whether it's a restaurant or a church, etc., but not get to a point where they become super spreader events? Is there a middle ground, is what I'm asking.
Yes, I think there is a middle ground. I mean, there's a difference between mass gatherings and sensibly trying to manage the numbers in small areas like restaurants. I mean, in general, what's been used previously in South Africa for small businesses and, for example, restaurants has been 50% capacity. But it does, of course, depend on the size of the venue. I mean, if you've got an enormous venue that can seat 1,000 people, then putting a number of 10 or 50 into that, doesn't make sense. But I mean, the bottom line is that, we need to ensure that we spend as little time as possible indoors in mass gathering areas, and that the same public health interventions that everyone is probably bored sick of, but this is what needs to be done. The social distancing, the reduction of indoor area mass gatherings, the hand hygiene, etc. This is what will limit the size of the third wave, and indeed waves to come, because unless we get our act together and really accelerate vaccination, we're looking at third, fourth, fifth, and maybe sixth waves.
Professor, I'm not sure if you heard when I had a conversation a moment ago with Professor Tulio de Oliveira about the vaccination. I'm glad you brought up the word vaccination. This issue with COVAX over in India, obviously the numbers there, as I use the word, staggeringly scary. What's happening in India, there's now a potential halt of exports of those vaccinations to Africa and obviously to South Africa. How much of a setback is that for us here in SA?
Yeah, so look, I mean, as you say, an incredibly serious situation going on in India, and the Serum Institute of India that produces mainly the AstraZeneca vaccine is going to be, impacted by that, and the need for vaccination within India is obviously key. In South Africa, we're using the Johnson & Johnson, as you know, and mainly the Pfizer, and so that may not be affected quite so much by the COVAX facility. But for Africa in general, this is not good news, because COVAX is an important supply line for Africa in terms of the vaccine numbers. But we really need to concentrate now, not just on vaccine numbers, but actually getting those vaccines into people's arms. And that's a massive undertaking in South Africa, and we have got to accelerate very, very rapidly now if we're going to impact over the next 12 to 18 months in South Africa.
Is there a target that you can put down for government to achieve? I mean, I understand these are moving goalposts and almost impossible to predict, but is there a percentage that you could advise government on? We're hearing that by the end of June, 5 million vaccinations, but obviously a professor such as yourself, I would imagine there is a target that you think as a country we should be hitting almost monthly to try and get on top of this within 12 to 18 months.
Yeah, look, I think 5 million by the end of June is aspirational. I'll be absolutely delighted if that happens. I think it's very unlikely to do so. It's very difficult to put a number on it. I mean, one generally would say that you need to try and get to 60 to 70% of the population with immunity, and that would be through vaccination and through natural immunity. So we need to make those calculations, and we need to try and get this out as quickly as possible. I think we need to think about decentralizing the whole process. There are numerous outlets that could be involved. By just limiting it to government centres, as is planned, I think is a mistake.
Professor, one last question to you then, if we go back to just the super spreading events and the potential of stricter lockdown restrictions before I say goodbye to you. Obviously, government is watching you and I speak right now. Of course they do. They're all watching us. What would you give them as far as some advice to try and limit the damage potentially for this third wave? We're talking about super spreader events, but perhaps you can be more specific. Is this restricting churches? Is it restricting casinos? If they're watching, what do you tell them to try and get on top of this?
Well, I would tell them what they already know, and that is that we should be banning mass gatherings right now. I think that bringing down this allowance of 500 outdoors, 250 indoors, really to limit all mass gatherings, whether it be churches, casinos, or any indoor areas. And, the government knows this well. Things have changed, obviously, in COVID in terms of variants of concern, etc. But even without the 617.2 variant, this new variant that was first in India, coming to South Africa, even without that, we'd be facing a third wave. And so, government knows what needs to be done. It just needs to do it now.
Professor, it's always such a pleasure speaking to someone like you who can help make sense of this for someone like me. My thanks to Professor Mark Mendelson, Head of Infectious Diseases and HIV Medicine at UCT, the University of Cape Town.